I've experienced a lot of, I wouldn't say a lot, but some failures from the believers that I've worked with or partnered with, much, much more than those who don't come from a Christian faith at all, but are very God-fearing. And I underline the word God-fearing, really trying to abide by the basic moral law that God has put in all of our hearts regarding integrity, cheating, etc., etc. So I'm inclusive, and I like to work with anyone who has a strong commitment to values that are biblical, even though that person might not believe in the Bible. But that's my point of view. Lastly, the whole person, I think, my entry into mental health has widened my, I don't know, I would say listening ears or attention to the employees that we have as being a whole person, not just a person who needs a check at the end of the month, or who needs a career upgrade, but also that this person is a person whose mental health inside the company is going to affect his wife, is going to affect his children, is going to affect other colleagues, maybe in church or outside of church. So it has opened my eyes to the fact that in any business we may run or be part of, it will be very wise for us to open our eyes and see people as a complete person, not just if he's handicapped or he's crippled, but actually many of us are crippled, but mentally. And this is even more painful than physical crippling sometimes, because people don't see it and we are afraid to talk about it. So I really encourage churches to have seminars on mental health, schools to have seminars for the parents and the children, community centers. This should be a regular, non-negotiable part of any discipleship, even curriculum, because we need awareness, we need basic education in order to prevent symptoms becoming a serious disease. So I really appreciate this time. I'm done. Thank you so much, and looking forward to collaborating, perhaps in online therapy together, and seeing how we can really move Africa forward in this space. It's 1 billion people, and I really don't want the statistics in the US to apply to our people in Africa. And I think we need to move very quickly with NGOs and large corporates and churches and so on, and educate as soon as possible, while perhaps using online therapy as one of the channels, in addition to all the channels Dr. Audrey talked about with the legislation and education and empowering of different segments of the community. Thank you very much.
Thank you very much, Neda, for that very focused presentation. We're now going to the Q&A session, starting.
But okay, let me generalize the answer. So it depends on what kind of anxiety you're having. Anxiety is a normal part of everyday life. Like we have anxiety over things that it helps us stay alive. Because, like, for example, if you're on the road and you're walking on the road and you're anxious about a car hitting you, that's what makes you stay off the road, right? But if you're talking about anxiety that's gone to a place where you can't function, you can't do the normal things that you do, you would definitely have to speak to somebody. It's not something that can be just generalized here on this platform. So anxiety shows itself up in different ways, and it can paralyze you from doing things that you would normally do. So someday you would definitely have to speak to someone about anxiety, because I need to know what exactly you're anxious about. There's so many things to be anxious about. So I guess I would need to know what the person is anxious about, and then we can talk about how to deal with that. But your first step would be to see somebody or to speak to somebody, and then we can get to the roots of the anxious behaviors and the anxious thoughts, and that would normally help.
Now, when you say see somebody, what about person specifically should the person go to?
Your primary health care would be, it would be a doctor. You would see a doctor who could refer you. But in Nigeria, I know that is challenging. So you would have to look for a counselor. Now, with, like I think Dr. Nader said as well, online counseling will probably be your best place to start, because it's so limited in Nigeria where you could find a counselor. But you could find a counselor, you could find a registered counselor, perhaps even in the church. But I do caution that the counselor should be a registered counselor, somebody who has had education in counseling and psychological education, so that we're not just giving good advice, because that's not what counseling is. So it would have to be either an online registered counselor or to see a counselor face-to-face.
In our environment, I would think that a psychology, a clinical sort of person, the people called clinical psychologists, would be more appropriate. If you can hear me, let's go pick some online questions now. There's a question online which says, in Nigeria, is it only the psychiatric hospital that can treat depression? That should go to Audrey.
What I was trying to answer. Can you hear me?
Yeah, you can hear you. In Nigeria, is it only the psychiatric hospital that can treat depression?
No, it's not only the psychiatric hospitals that can treat depression. Counselors can treat depression, which is what I was trying to answer, that there's so few psychiatrists in Nigeria that you will have to make use of counselors, of proper psychological counselors, because they're good as a first aid. Suicide in Nigeria is on the increase. I have statistics for suicide, but the problem with the statistics for suicide is that sometimes suicide deaths are not reported as suicides because of culture stigma. So the statistics for suicides are very, very, very poor. And they can get away with not reporting. I mean, I can see Dr. Nader nodding, because it's probably true, right, in Egypt as well. But the statistics for suicides in Nigeria is not very reliable. But Nigeria is, according to the WHO report of 2018, is the 15th most is the 15th nation in the suicide list of the world. We're number 15. Now, please note that depression doesn't always lead to suicide. There are other things that can give people suicidal ideations. So it's not always depression. People can go through their whole life having depression and not want to commit suicide. But we are number 15 in the world.
Okay. Thank you very much.
With suicide, according to the 2019 WHO statistics.
Thank you. Now, this goes to Nader. Can mental illness be cured completely? An online question. Can mental illness be cured completely?
I mean, definitely research says that there is a path to healing in mental illness. It's not something that is you are destined to stay with. So depending on how early you take treatment, depending on the qualifications of the actual therapist, and sometimes depending on the actual tasks that the person is required to do, like meditation, breathing, etc., depending, then yes, there are people who have overcome mental illness and succeeded to function well in life. Does that mean that you are healed forever? Does not mean that, of course, just like if you have other illnesses that might come back to you. But definitely this profession has gone through many advancements the past 20, 30 years, and there's a lot of research that proves that there is effective treatment, yes.